60 NCLEX pharmacology questions. A nurse is monitoring patient compliance with the diabetes mellitus treatment regimen. What value indicates compliance with the regimen? HbA1c of 4% to 6%. This is the best indicator of average blood glucose levels for the past 120 days. A nurse is taking care of a client prescribed omeprazole, Prilosex. What information should the nurse provide regarding administration of this medication? Take medication in the morning before breakfast. A clinic nurse is preparing to administer a Penicillin IM injection to a client who has never taken the medication before. What should be included in the plan of care? Instruct the client to sit in the clinic for 30 minutes after the injection. To ensure prompt treatment if anaphylaxis occurs. A nurse is caring for a client with a history of rheumatoid arthritis who is receiving methotrexate, Rheumotrex. What should be included in client education? The CBC will be monitored. Bone marrow suppression is a common side effect of using methotrexate for long-term therapy of RA. During administration of vancomycin, vancomycin, IV, the nurse notices the client's neck and face becoming flushed. What action should the nurse take first? Slow the rate of infusion. A nurse is to administer morphine sulfate 10 mg intramuscular, IM, to an adult client for postoperative pain. Which injection site is the most appropriate? Ventrogluteal. This site is a deep site, situated away from the major nerves and blood vessels. This site is preferred for medications, such as antibiotics, that are larger in volume, more viscous, and irritating for adults, children, and infants. This site is safe for all clients with large muscle development. A nurse is monitoring a client newly diagnosed with diabetes mellitus for signs of complications. Which of the following, if exhibited in the client, would indicate hyperglycemia and warrant physician notification? A. Polyuria. B. Diaphoresis. C. Hypertension. D. Increased pulse rate. A. Polyuria. Classic symptoms of hyperglycemia include polydipsia, polyuria, and polyphagia. Options B, C, and D are not signs of hyperglycemia. The nurse is teaching the client with insulin-dependent diabetes the signs of hypoglycemia. Which of the following signs is associated with hypoglycemia? A. Tremulousness. B. Slow pulse. C. Nausea. D. Flushed skin. Answer A is correct. Tremulousness, a state of trembling or quivering, is an early sign of hypoglycemia. Answers B, C, and D are incorrect because they are symptoms of hyperglycemia. A patient arrives at the emergency department complaining of back pain. He reports taking at least 3 acetaminophen tablets every 3 hours for the past week without relief. Which of the following symptoms suggests acetaminophen toxicity? A. Tinnitus. B. Diarrhea. C. Hypertension. D. Hepatic damage. Answer. D. Acetaminophen in even modestly large doses can cause serious liver damage that may result in death. Immediate evaluation of liver function is indicated with consideration of N-acetylcysteine administration as an antidote. Tinnitus is associated with aspirin overdose, not acetaminophen. Diarrhea and hypertension are not associated with acetaminophen. A nurse is caring for a cancer patient receiving subcutaneous morphine sulfate for pain. Which of the following nursing actions is most important in the care of this patient? A. Monitor urine output. B. Monitor respiratory rate. C. Monitor heart rate. D. Monitor temperature. Answer. B. Morphine sulfate can suppress respiration and respiratory reflexes, such as cough. Patients should be monitored regularly for these effects to avoid respiratory compromise. Morphine sulfate does not significantly affect urine output, heart rate, or body temperature. A nurse is administering blood to a patient who has a low hemoglobin count. The patient asks how long do RBCs last in my body? The correct response is A. The lifespan of RBC is 45 days. B. The lifespan of RBC is 60 days. C. The lifespan of RBC is 90 days. D. The lifespan of RBC is 120 days. D. The lifespan of RBC is 120 days. A nurse is preparing the client's morning NPH insulin dose and notices a clumpy precipitate inside the insulin vial. The nurse should A. Draw up and administer the dose. B. Shake the vial in an attempt to disperse the clumps. C. Draw the dose from a new vial. D. Warm the bottle under running water to dissolve the clump. C. The nurse should always inspect the vial of insulin before use for solution changes that may signify loss of potency. NPH insulin is normally uniformly cloudy. Clumping, frosting, and precipitates are signs of insulin damage. In this situation, because potency is questionable, it is safer to discard the vial and draw up the dose from a new vial. A patient who has type 2 diabetes has a glycated hemoglobin, HbA1c, result of 10%. A nurse should make which of these changes to the nursing care plan? A. Refer to a diabetic educator, there is poor glycemic control. B. Glycemic control is adequate, no changes are needed. C. Hypoglycemia is a risk, teach the patient the symptoms. D. Instruct the patient to limit activity and weekly exercise. A. Refer to a diabetic educator, there is poor glycemic control. At 5 p.m. a patient who is taking NPH insulin develops hunger, shakiness, and sweating. A nurse assesses the medication administration record, MAR, and should recognize that the patient's symptoms are related to an injection of NPH insulin at which of these times? A. 2 a.m. B. 8 a.m. C. 1 p.m. D. 3 p.m. A. 2 a.m. The patient is exhibiting symptoms of hypoglycemia at 5 p.m. NPH has a peak action of 8 to 10 hours after administration. Based on the duration of action of NPH insulin, the patient's hypoglycemic symptoms are from the 8 a.m. injection of NPH insulin. An injection of NPH insulin at 2 a.m., 1 p.m., or 3 p.m. would not cause hypoglycemic symptoms based on the average duration of action from NPH insulin. A patient is taking glipizide, glucotrol, and a beta-adrenergic medication. A nurse is teaching hypoglycemia awareness and should tell the patient that which of these symptoms may not occur? A. Vomiting. B. Muscle cramps. C. Tachycardia. D. Chills. C. Tachycardia. Glipizide is a sulfonylurea oral hypoglycemic medication that acts to promote insulin release from the pancreas. Beta-adrenergic blockers can mask early signs of sympathetic system responses, most importantly, tachycardia, to hypoglycemia, which is the most common adverse effect of glipizide. Vomiting, muscle cramps, and chills are not symptoms of activation of the sympathetic nervous system that arise when glucose levels fall. Which of these characteristics should a nurse associate with a patient who has type 2 diabetes? Select all that apply. A. Exercise and diet may be sufficient treatment. B. Is often obese with difficulty managing weight. C. Prone to ketosis and ketoacidosis complications. D. Genetics and strong familial links are causal factors. E. Insulin resistance and inappropriate secretion. A. B. D. E. A nurse caring for a patient who has diabetic ketoacidosis recognizes which of these characteristics in the patient? Select all that apply. A. Occurs mainly in type 2 diabetes patients. B. Altered fat metabolism leading to ketones. C. Arterial blood pH of 7.35 to 7.45. D. Sudden onset, triggered by acute illness. E. Plasma osmolality of 300 to 320 milliosmoles, lb. D. E. A postoperative patient has an epidural infusion of morphine sulfate, Astromorph. The patient's respiratory rate declines to 8 breaths per minute. Which medication would the nurse anticipate administering? A. Naloxone, Narcan. B. Acetylcysteine, Mucomyst. C. Methylprednisolone, Solumedrol. D. Protamine sulfate. A. Naloxone, Narcan. Naloxone is a narcotic antagonist that can reverse the effects, both adverse and therapeutic, of opioid narcotic analgesics. The nurse is planning care for a patient receiving morphine sulfate, Duramorph, by means of a patient-controlled analgesia, PCA, pump. Which intervention may be required because of a potential adverse effect of this drug? A. Administer cough suppressant. B. Insert Foley catheter. C. Administer antidiarrheal. D. Monitor liver function tests. B. Insert Foley catheter. Morphine can cause urinary hesitancy and urinary retention. If bladder distension or the inability to void is noted, the prescriber should be notified. Urinary catheterization may be required. Morphine acts as a cough suppressant and an antidiarrheal, so neither of those drugs would need to be administered to counteract an adverse effect of morphine. Liver toxicity is not a common adverse effect of morphine. A patient admitted to the hospital with a diagnosis of pneumonia asks the nurse, "Why am I receiving codeine? I don't have any pain." The nurse's response is based on the knowledge that codeine also has which effect? A. Immunostimulant. B. Antitussive. C. Expectorant. D. Immunosuppressant. B. Antitussive. Codeine provides both analgesic and antitussive therapeutic effects. A patient takes oxycodone, OxyContin, 40 mg PO twice daily, for the management of chronic pain. Which intervention should be added to the plan of care to minimize the gastrointestinal adverse effects? A. Take an antacid with each dose. B. Eat foods high in lactobacilli. C. Take the medication on an empty stomach. D. Increase fluid and fiber in the diet. D. Increase fluid and fiber in the diet. Narcotic analgesics reduce intestinal motility, leading to constipation. Increasing fluid and fiber in the diet can help manage this adverse effect. Which agent below is most likely to cause serious respiratory depression as a potential adverse reaction? A. Morphine, Duramorph. B. Pentazocine, Talwin. C. Hydrocodone, Lortab. D. Namifene, Revex. A. Morphine, Duramorph.
A client in the ICU tells the nurse he is experiencing severe pain. Prior to administering a narcotic analgesic to this client, the nurse will conduct a pain assessment to include A. Pain. B. Nociception. C. Pain behaviors. D. Suffering. C. Pain behavior. There is a theory that addresses pain as having four facets: nociception, pain, suffering, and pain behaviors. Of these four facets, only the fourth, pain behavior, can be observed. This nurse will only be able to assess the client's pain behavior in the pain assessment. A client in the ICU who sustained a traumatic abdominal injury 1 week ago continues to complain of severe pain. The nurse notes his vital signs are normal. Which of the following would be appropriate for the nurse to do? A. Encourage early return to ambulation. B. Offer non-narcotic analgesics for pain. C. Utilize distraction. D. Provide the client with pain medication. D. Provide the client with pain medication. The nurse is creating a pain management plan for a client with a previous history of substance abuse. Which of the following should be included in this plan? A. Ask the physician to prescribe short-acting analgesics. B. Ask the physician to prescribe a medication similar to the one the client abused. C. Ask the physician to prescribe all analgesics for the oral route. D. Keep a dose of Narcan at the bedside. C. Ask the physician to prescribe all analgesics for the oral route. Extended release and long-acting analgesics are recommended for clients with a history of abuse. Specific interventions should avoid analgesics similar to the abused drug, utilize long-acting analgesics, avoid Narcan, and administer medications through the oral route. The safest narcotic choice for an elderly client with acute pain is A. Meperidine, Demerol. B. Oxycodone. C. Fentanyl transdermal patch. D. Morphine sulfate. D. Morphine sulfate. Rationale: morphine is the gold standard of narcotics for acute pain. The other choices are incorrect. A patient with newly diagnosed type 2 diabetes mellitus asks the nurse what type 2 means in relation to diabetes. The nurse explains to the patient that type 2 diabetes differs from type 1 diabetes primarily in that with type 2 diabetes, A. the patient is totally dependent on an outside source of insulin. B. there is decreased insulin secretion and cellular resistance to insulin that is produced. C. the immune system destroys the pancreatic insulin-producing cells. D. the insulin precursor that is secreted by the pancreas is not activated by the liver. B. Rationale: in type 2 diabetes, the pancreas produces insulin, but the insulin is insufficient for the body's needs or the cells do not respond to the insulin appropriately. The other information describes the physiology of type 1 diabetes. A patient screened for diabetes at a clinic has a fasting plasma glucose level of 120 mg/dl, 6.7 mol/L. The nurse will plan to teach the patient about A. use of low doses of regular insulin. B. self-monitoring of blood glucose. C. oral hypoglycemic medications. D. maintenance of a healthy weight. D. rationale: the patient's impaired fasting glucose indicates prediabetes and the patient should be counseled about lifestyle changes to prevent the development of type 2 diabetes. The patient with prediabetes does not require insulin or the oral hypoglycemics for glucose control and does not need to self-monitor blood glucose. When assessing the patient experiencing the onset of symptoms of type 1 diabetes, which question should the nurse ask? A. Have you lost any weight lately? B. Do you crave fluids containing sugar? C. How long have you felt anorexic? D. Is your urine unusually dark-colored? A. Rationale: weight loss occurs because the body is no longer able to absorb glucose and starts to break down protein and fat for energy. The patient is thirsty but does not necessarily crave sugar-containing fluids. Increased appetite is a classic symptom of type 1 diabetes. With the classic symptom of polyuria, urine will be very dilute. During a clinic visit 3 months following a diagnosis of type 2 diabetes, the patient reports following a reduced calorie diet. The patient has not lost any weight and did not bring the glucose monitoring record. The nurse will plan to obtain A fasting blood glucose level. B urine dipstick for glucose. C glycosylated hemoglobin level. D oral glucose tolerance test. C rationale, the glycosylated hemoglobin, HbA1c, test shows the overall control of glucose over 90 to 120 days. A fasting blood level indicates only the glucose level at one time. Urine glucose testing is not an accurate reflection of blood glucose level and does not reflect the glucose over a prolonged time. Oral glucose tolerance testing is done to diagnose diabetes, but is not used for monitoring glucose control once diabetes has been diagnosed. Which drug is often used when a patient has a penicillin allergy? Macrolides, erythromycin, azithromycin. Which drug causes a medication interaction when taken with milk, antacids, and magnesium-containing products? Tetracyclines. What adverse effects is a concern with aminoglycosides, gentamicin? Otoxicity, nephrotoxicity, and hypersensitivity. How should the nurse monitor trough and peak levels in a patient receiving aminoglycosides, gentamicin, streptomycin, neomycin? Peak levels, 30 minutes after administration of infusion. Trough levels, 1 hr before next scheduled dose. What are the 3 interactions of aminoglycosides? Coumadin, penicillin, and loop diuretics. The nurse is working on a postoperative unit where pain management is part of routine care. Which statement below is the most helpful in guiding clinical practice in this setting? A. At least 30% of the U.S. population is prone to drug addiction and abuse. B. The development of opioid dependence is rare when opioids are used for acute pain. C. Morphine is a common drug of abuse in the general population. D. The use of PRN, as needed, dosing provides the most consistent pain relief without risk of addiction. B. The development of opioid dependence is rare when opioids are used for acute pain. A nurse administers naloxone, Narcan, to a postoperative patient experiencing respiratory sedation. What undesirable effect would the nurse anticipate after giving this medication? A. Drowsiness. B. Tics and tremors. C. Increased pain. D. Nausea and vomiting. C. Increased pain. Naloxone is a medication that reverses the effects of narcotics. Although the patient's respiratory status will improve after the administration of naloxone, pain will be more acute. The client informs the nurse that he has experienced pain in the lower extremities for the past 8 months. The nurse recognizes that this pain is classified as A. Moderate. B. Severe. C. Acute. D. Chronic. D. Chronic. Chronic pain persists longer than 6 months. A client who incurred an arm injury describes his pain as sharp and localized to the lower arm. The nurse recognizes that this type of pain would be relieved best by administration of which type of medication? A. Muscle relaxant. B. Acetaminophen. C. Narcotic analgesics. D. Ice packs. C. Narcotic analgesics. Injury to tissues produces nociceptor pain, which usually responds to conventional analgesic pain medications such as opiates or NSAIDs. The nurse teaches the client relaxation techniques and guided imagery as an adjunct to medication for treatment of pain. The nurse explains that the major benefit of these techniques is that they A. Are less costly. B. Allow lower doses of drugs with fewer side effects. C. Can be used at home or in any environment. D. Do not require self-injection. B. Allow lower doses of drugs with fewer side effects. When used concurrently with medication, non-pharmacologic techniques can allow for lower doses, and possibly fewer drug-related adverse effects. The other options also are advantages to guided imagery and relaxation, but not the major one. The nurse recognizes that opioid analgesics exert their action by interacting with a variety of opioid receptors. Drugs such as morphine act by activating mu and kappa. The client admitted with hepatitis B is prescribed Vicodin tabs 2 for treatment of pain. The appropriate nursing action is to A. Administer the drug as ordered. B. Administer 1 tablet only. C. Question the physician about the order. D. Hold the drug until the physician arrives. C. Question the physician about the order. Vicodin is a combination drug of hydrocodone and acetaminophen. Acetaminophen can be hepatotoxic, and is contraindicated in liver disease. The nurse administers morphine sulfate 4 mg 4 to a client for treatment of severe pain. Which of the following assessments requires immediate nursing interventions? A. Blood pressure 110/70. B. The client is drowsy. C. Pain is unrelieved in 15 minutes. D. Respiratory rate 10/minute. D. Respiratory rate 10/minute. Opioids activate mu and kappa receptors that can cause profound respiratory depression. Respiratory rate should remain above 12. The BP is not significantly low. Drowsiness is an expected effect of morphine. Unrelieved pain warrants further assessment, but not as immediately as do decreased respirations. Nursing intervention for a client receiving opioid analgesics over an extended period of time should include: A. Referring the client to a drug treatment center. B. Encouraging increased fluids and fiber in the diet. C. Monitoring for GI bleeding. D.0 Teaching the client to take her own blood pressure. B. Encouraging increased fluids and fiber in the diet. Opioids suppress intestinal contractility, increase anal sphincter tone, and inhibit fluids into the intestines, which can lead to constipation. There is nothing to indicate the drug is related to addiction problems. Opioids do not cause GI bleeding. Naloxone, Narcan, is administered to a client with severe respiratory depression and suspected drug overdose. After 20 minutes, the client remains unresponsive. The most likely explanation for this is: A. The client did not use an opioid drug. B. The dose of naloxone was inadequate. C. The client is resistant to this drug. D. The drug overdose is irreversible. A. The client did not use an opioid drug. If opioid antagonists, naloxone, fail to reverse symptoms of respiratory depression quickly, the overdose was likely due to a non-opioid substance. Celecoxib, Celebrex, is added to the treatment regimen of a client with arthritis. The nurse explains that the major advantage of this drug is: A. The drug is less expensive. B. The drug has no known side effects. C. The drug has anti-inflammatory properties. D. The drug's effectiveness is the same as opioids. C. The drug has anti-inflammatory properties. Celecoxib, Celebrex, has anti-inflammatory properties. It is not less expensive, has many side effects, and is less potent than opioids. Blood sugar is well controlled when hemoglobin A1C is: A. Below 7%. B. Between 12%–15%. C. Less than 180 mg/dl. D. Between 90 and 130 mg/dl. A. Below 7%. A1C measures the percentage of hemoglobin that is glycated and determines average blood glucose during the 2 to 3 months prior to testing. Used as a diagnostic tool, A1C levels of 6.5% or higher on 2 tests indicate diabetes. A1C of 6% to 6.5% is considered prediabetes. Untreated hyperglycemia may lead to all of the following complications except: A. Hyperosmolar syndrome. B. Vitiligo. C. Diabetic ketoacidosis. D. Coma. B. Excessively high blood sugar or prolonged hyperglycemia can cause diabetic ketoacidosis, the condition in which the body breaks down fat for energy and ketones spill into the urine. Diabetic hyperosmolar syndrome occurs when blood sugar is excessively high and available insulin is ineffective. In this case, the body cannot use glucose or fat for energy and glucose is excreted in the urine. Without immediate medical attention, both conditions may result in coma or death. Which of the following diabetes drugs acts by decreasing the amount of glucose produced by the liver? A. Sulfonylureas. B. Meglitinides. C. Biguanides. D. Alpha-glucosidase inhibitors. C. Biguanides. Biguanides, such as metformin, lower blood glucose by reducing the amount of glucose produced by the liver. Sulfonylureas and meglitinides stimulate the beta cells of the pancreas to produce more insulin. Alpha-glucosidase inhibitors block the breakdown of starches and some sugars, which helps to reduce blood glucose levels. The benefits of using an insulin pump include all of the following except: A. By continuously providing insulin they eliminate the need for injections of insulin. B. They simplify management of blood sugar and often improve A1C. C. They enable exercise without compensatory carbohydrate consumption. D. They help with weight loss. D. They help with weight loss. Using an insulin pump has many advantages, including fewer dramatic swings in blood glucose levels, increased flexibility about diet, and improved accuracy of insulin doses and delivery. However, the use of an insulin pump has been associated with weight gain. A patient has just been diagnosed with diabetes mellitus. His doctor has requested glucagon for emergency use at home. The nurse instructs the patient that the purpose of this drug is to treat a. Hyperglycemia from insufficient insulin injection. b. Hyperglycemia from eating a large meal. c. Hypoglycemia from insulin overdose. d. Lipohypertrophy from inadequate insulin absorption. c. Hypoglycemia from insulin overdose. Glucagon is for emergency use for insulin overdose. The patient will usually arouse within 20 minutes if unconscious. The family should also be instructed how to use the glucagon injection as well. Which of the following statements from a newly diagnosed client with diabetes indicates more instruction is needed? A. I need to check my feet daily for sores. B. I need to store my insulin in the refrigerator. C. I can use my plastic insulin syringe more than once. D. I need to see my doctor for follow-up exams. B. I need to store my insulin in the refrigerator. Insulin only needs to be stored in the refrigerator if it won't be used within 6 weeks, after being opened. It should be at room temperature when given to decrease pain and prevent lipodystrophy. The healthcare provider prescribes naproxen, twice daily for a client with osteoarthritis of the hands. The client tells the nurse that the drug does not seem to be effective after 3 weeks. Which is the best response for the nurse to provide? A. The frequency of the dosing is necessary to increase the effectiveness. B. Therapeutic blood levels of this drug are reached in 4 to 6 weeks. C. Another type of nonsteroidal anti-inflammatory drug may be indicated. D. Systemic corticosteroids are the next drugs of choice for pain relief. C. Another type of nonsteroidal anti-inflammatory drug may be indicated. The nurse instructs a patient about how insulin affects blood glucose. Arrange the events in sequence. 1. Beta cells are stimulated to release insulin. 2. Glucose enters the bloodstream. 3. Glycogen is converted to glucose by alpha cells, glycogenesis. 4. Glycogen is stored in the liver. 5. Insulin transports glucose to muscle cells. Answer 2,1, 5, 4, 3. The teaching plan for a diabetic is focused on smoking cessation and control of hypertension for the avoidance of microvascular complications, such as, select all that apply. 1. Macular degeneration. 2. End-stage renal disease, ESRD. 3. Coronary artery disease, CAD. 4. Peripheral vascular disease, PVD. 5. Cerebrovascular accident, CVA. ANS, 1, 2. Macular degeneration and ESRD are both microvascular complications. CAD, PVD, and CVA are all macrovascular complications. A patient has come to the doctor's office after finding out that her blood glucose level was 135 mg/dl. She states that she had not eaten before the test and was told to come and see her doctor. She asks you if she has diabetes. The nurse responds. 1. Having a fasting serum glucose that high certainly indicates diabetes. 2. That test indicates that we need to do more tests that are specific for diabetes. 3. How do you feel? Do you have any other signs of diabetes? 4. Do you have a family history of diabetes, stroke, or heart disease? We need to know before making a diagnosis. 2. That test indicates that we need to do more tests that are specific for diabetes. The nurse needs to answer the patient's question in a way that gives information and is not misleading. Although 135 is high, there may be a non-pathologic explanation. More tests should be done to evaluate the patient. A patient has come into the emergency room with her friend. Her friend states that she had been acting very strangely and confused. The friend states that the patient has diabetes and takes insulin. The nurse knows that signs and symptoms of hypoglycemia include 1. Slow pulse rate and low blood pressure. 2. Irritability, anxiety, confusion, and dizziness. 3. Flushing, anger, and forgetfulness. 4. Sleepiness, edema, and sluggishness. 2. Irritability, anxiety, confusion, and dizziness. When blood sugar levels fall, hormones are activated to increase serum glucose. One of the hormones is epinephrine, which causes these symptoms. The patient with type 2 diabetes shows a blood sugar reading of 72 at 6 a.m. Based on the reading of 72, the nurse should 1. Notify the charge nurse of the reading. 2. Give regular insulin per sliding scale. 3. Give him cup of milk. 4. Administer the oral hyperglycemic tablet. ANS, 3. Milk. The patient is hypoglycemic and needs an immediate source of glucose, such as milk or orange juice. The oral hyperglycemic agent will not work quickly enough. Notifying the charge nurse can be done later. Giving insulin per sliding scale would lower the blood sugar level. When the type 2 diabetic patient says, "Why in the world are they looking at my hemoglobin? I thought my problem was with my blood sugar." The nurse responds that the level of hemoglobin A1C 1 shows how a high glucose level can cause a significant drop in the hemoglobin level. 2 shows what the glucose level has done for the last 3 months. 3 indicates a true picture of the patient's nutritional state. 4 reflects the effect of high glucose levels on the ability to produce red blood cells. ANS 2 By analyzing the amount of glucose bound to the hemoglobin, the level of blood glucose can be evaluated for the last 3 months, because the glucose stays bound to the hemoglobin for the life of the red blood cell, RBC. When a newly diagnosed type 2 diabetes mellitus patient asks the nurse why she has to take a pill instead of insulin, you reply that in type 2 diabetes, the body makes insulin but 1. Overweight and underactive people simply cannot use the insulin produced. 2. Metabolism is slowed in some people, so they have to take a pill to speed up their metabolism. 3. Sometimes the autoimmune system works against the action of the insulin. 4. The cells become resistant to the action of insulin. Pills are given to increase the sensitivity. ANS 4. Type 2 diabetes mellitus is a disease in which the cells become resistant to the action of insulin and the blood glucose level rises. Oral hyperglycemic agents make the cells more sensitive.